Listening Part A. You hear a specialist physician talking to a patient called David Johnson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
It's nice to meet you, Mr. Johnson. You've been referred to me by Dr. Bruce. Why don't you tell me why you're here?
About a week ago, I was in a car accident. Nothing really happened at the time. I spoke to a doctor that day, but he was still a bit concerned. So a couple of days later, I think it was about that, I definitely started to feel a little bit different.
So what happened when you first went to the doctor?
Well, right after the accident, there was really no problem. I didn't feel anything. It didn't hurt at all. He did say, the doctor I mean, he said that I should just watch out or pay attention to see if I had a sore neck or sore back or anything. And that's what happened. A few days later, I was starting to feel a little bit dizzy. And then, well, that's when he said it was definitely whiplash and he referred me to you.
Okay, and so how have you been feeling since then?
Well, I've definitely had a sore neck. It's really been bothering me the last day or so. And like I said, I've been feeling a bit dizzy. Actually, I have to sit down once in a while because it gets a little disruptive. Difficult to work and that sort of stuff. I've been feeling a bit sick too. I actually had to take yesterday and today off work because I'm finding it quite difficult. I've been really tired as well.
Is there anything else in your medical history that I should be aware of? Any allergies or any other recent visits to the doctor?
I don't think there's anything that pertains to this injury. I am allergic to penicillin. I just found that out recently actually. That could have been quite dangerous. And last year I had the flu really, really bad. But nothing that really relates to this.
It says here you play hockey.
Yeah, every weekend.
Any injuries that I should know about?
Not really. I've been pretty lucky actually. A couple of months ago I had a sprained ankle, which is pretty common in hockey. We usually have good trainers though, and they keep an eye on us. We also take good care of ourselves.
Nothing serious then?
No, I've been pretty lucky.
And just take me through your family's medical history.
Let me think about that. Well, there's hypertension and heart disease. Those are two things that have been there for my grandparents and my parents. My parents actually take it quite seriously, so they're eating a lot better these days. I do as well. And my grandfather had a stroke a few years ago. That was pretty hard, and now he's showing some early signs of Alzheimer's.
Okay, well I'd like to examine you in a minute, but first I really need to make you understand you're going to have to stop the sports for the moment.
Oh really?
Uh-huh.
That's kind of a tough one, Doctor. Sports are a pretty big part of my life. I mean, I really don't know how I feel about, it's pretty tough for me to sit still, and we have to do this big hockey tournament next week. Is there really no way I can play in that? I mean, I can take it easy when I am playing. There's got to be a way I can get out on the field. I mean, I've been working toward this all year.
Well, I can't stop you from playing, but I strongly advise against it because if you get hurt, you can cause some permanent serious damage. So you really need to rest and stay off your feet until we know what's causing these symptoms.
What if I'm feeling okay by next week? Would it be alright to, play then? If that was the case. You hear a doctor talking to a patient called Mrs. June Wilcox. Complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mrs. Wilcox, your GP referred you to me because you've been having a bit of trouble sleeping. Why don't you tell me what's been happening?
Okay, yes, that's right. I suppose I've always had some trouble breathing fully through my nose, especially through my left nostril, but I feel like it's been worse in the past few years. I used to play a lot of sport, especially netball, but I've had to give it away because I was getting so terribly short of breath. So while it's there during the day, the blockage, it's even worse at night. When it's time for bed, well, sometimes the left side of my nose can feel completely stuffed up. My husband tells me that I've been snoring as well. It started a little over 12 months ago, I suppose. Yes, probably 12 to 18 months.
Do you feel tired in the morning?
I do, yes. Sometimes it can feel like I've hardly slept at all. And the back of my throat tastes like I've smoked a pack of cigarettes. I've tried some of those sprays, you know, those ones that you can get from the chemist, those decongestants, just to try and help clear my nose a bit. They used to work, but then after a while, they all stopped being effective. Then, when I first spoke to my GP about what was happening, she prescribed a spray for me. It's a combination corticosteroid antihistamine spray. It was wonderful. I really thought it was going to fix it right up, but she said I shouldn't really stay on that long term because she thought my issues were more structural. That's why she recommended I come and see you.
Okay, great. Do you mind if I take a look? This won't hurt, but it will allow me to confirm your GP's diagnosis.
No problem.
Okay, thanks. Well, it definitely looks like you have a deviated septum, and you have some quite large turbinates as well.
Right, okay. That's what the GP said, wasn't it?
Yes, it isn't so unusual. Almost no one has a completely straight nose. The issue is that yours is affecting your breathing, and that's making it harder for you to sleep.
Yes, that's right. Can it be fixed then?
It can, yes. The best option is usually a very simple surgical procedure called a septoplasty.
Right, I see. Surgery. I'm not so keen on that. The only other time I had surgery was on my knee, and it wasn't very successful. If anything, I think it actually made it worse.
Well, septoplasty is very successful and very common. It will allow me to straighten and align the cartilage structure that exists in the midline of your nose, and you'll find you'll be able to breathe much more freely after that.
I just don't know if that's the way I want to go.
There are other options we can try, perhaps less structurally invasive. I can outline some of those if you like.
Yeah, I just don't know. I can suffer with a bit of anxiety sometimes, you see. It's something I've had to battle with for a while now. I suppose I'm just a little worried that if we decide to go ahead with surgery, I might have some sort of panic attack, you know, on the day itself. I just don't know what I should do.